Let's try a hands-up experiment. I do this experiment with people when I teach at conferences with large rooms with lots of healthcare professionals. So my first question is, put your hand up if you teach patients things on a day-to-day basis in your clinic. Do you teach them how to do exercises, for example, or how to use a walking stick, for example? Yeah, and I'm sure you're now sticking your hand up. Education is a massive component of modern-day healthcare. Now put your hand up if you're trained as an educator who went through teacher training school, and I'm sure not many people will be putting their hand up at this point. My master's degree was in education, and it taught me this big gap, this big mismatch between the job that we have, we're essentially teachers, but we don't train how to teach, we don't learn how to teach. And this is a crucial problem that we need to explore. If we look at the word education, it comes from a Latin word, educare, and educare means to draw out things that are happening inside people, not to pour things in. And this is the problem that we make when we're teaching exercises, is that we try this copy and paste method. I'm doing it now. I'm talking to you and you will remember 100% of my words forever. Of course you won't. So we don't learn by listening to people talk. In other words, pouring in does not lead to learning. Drawing out is where the answers lie. The answers to people's problems lie in their words and their thoughts and their exercises, perhaps, not ours. As E.M. Forster once fabulously said, spoon feeding in the long run teaches us nothing but the shape of the spoon. Now, sadly, we know, and we'll look at some of the evidence here, when we teach exercise to patients, often patients are very passive. It's not an active process. We cast patients as passive recipients of our information, and then we wonder why they're not doing the things that we're asking them to do. So one of the first things we have to learn to do, if we acknowledge that the answers come from patients, not from ourselves, is we've got to be better at shutting up. So I'm constantly saying to myself in clinic, shut up, Mike, shut up, Mike. The answers are not with you. Healthcare communication is often didactic, it's paternalistic, it's clinician-led. We talk, they listen, we're the parent, they're the child. Often, Jones found that in this study in 2014, interestingly, the biggest obstacle to us helping our patients is our desire to fix and treat. And in doing so, we forget to do the most simple first step of communication, which is to listen and understand and try and understand what it is the person wants in front of you. So we see examples of this here, and this is an old study from 1991 from Morris. And if you read this with me, she told me that the high point in her life was playing the organ for her church choir. She lived for the twice-a-week practices and Sunday performances. Now, with pain immobilizing her elbow, she could no longer manage the keyboard. Her days held nothing that she looked forward to. The constant aching had robbed her of any hope. Life seemed empty of everything except pain. When I asked her if she had explained this to the staff in the clinic, she replied that they had not asked. Her medical history, as one might expect, read exactly like the history of an elbow. This is a problem because this is clearly a case of where the clinician is not really understanding the person, what the person wants, what their values are in life. And this comes back to that idea that we don't learn how to teach, we don't learn how to motivate and empower people, and it leads to problems. So we could be fooled into thinking, well, this is an old study from the 1990s. This problem doesn't exist anymore, but we would be wrong. This reflective exercise here I'd like you to do. Stop and pause the video for a bit and start to think about these three statements that I'm going to show you here. They come from Rob Stenner and colleagues' study in 2015. And I want you to notice anything particular about the language that's used, and do you recognize any of these sort of clinical assessments and judgments in how you think in clinical practice? Let's start with the first one. I have to say I don't particularly ask the patient what they want. I think giving them so much choice, they often get confused. It's almost too much for them. I must admit, for every low back pain I have coming in through my door, I pretty much always give them exercise. I don't think about it too hard. It's just part and parcel of what I do. Or overall, the objective assessment, plays a large role in the choice of exercises. I tend to work out what I think is best. Now, I'm sure you'd agree with me, the word that you see uttered most there is I. You know, it's paternalistic, it's clinician-led, it's didactic. The clinician is telling the patient what to do. And this, please don't think that this is for 1 second me pointing the finger and saying this is a naughty physio, this is a bad way to do things. This is a training error. If we're not learning how to teach, we're going to teach people exercises in this manner, and then we wonder why they don't do the exercises that we give them. As you can see from this photo, since the Queen sadly died here in the United Kingdom, the corgis have been having a whale of a time. But I'm showing you this image for a good reason. I think we have to learn from other professions sometimes. I'll give you an example. One time a lady came into my clinic and said, my hairdresser makes a better communicator than any of you lot in physio. I said, well, that's an interesting point. Why? He said, well, my hairdresser never begins the conversation by asking, how's your hair been since I last saw you? But of course, in physio, we do it all the time. How's your back been? How's your shoulder been? But I think we can really learn a lot from driving instructors. If we're going to get good at empowering people, driving instructors are the Jedi masters of empowerment. So I ask my patients 3 questions, and you can ask them the same questions to sort of think about this metaphor of, do you want to take control? Do you want the power? So the first question is, when did you learn how to drive? How long ago did you learn to drive? And people will say, 15 years ago. Second question, how many lessons did you have when you were learning how to drive a car? 10, 15 lessons? And the third and most important question, how many times have you needed the driving instructor since you passed your test? Since you learned how to drive, have you needed the driving instructor? And people will often say, well, no, I don't need the driving instructor. They taught me what to do, and now I'm doing it. This is really what empowerment is all about. Empowerment starts with an understanding that we have to lose power in order for the other person to gain power. We've got to get better at giving people the steering wheel